You know it's killing you, but your body is still craving it. And your mind says, give your body what it wants or else you're going to feel this way.
I've used my entire life as an adult, and I'm 67 now.
As much as I wanted to in my heart and in my soul get off drugs, I wasn't able to do it.
So, back on pain pills again.
Opiate addiction used to be untreatable, and most people with addiction to it have been hopeless about staying off of opiates.
Towards the end, it was actually killing me, and my body craved it. That's the addiction right there.
I'm Dr. Peter Rao. I'm a psychiatrist. I specialize in addiction medicine. I became interested in this field because of how hideous opiate addiction is and how difficult it's been historically to treat it. Historically, opiate addiction is a lifelong illness. People are just not able to stay away from taking opiates.
Recurring relapses.
Opiate addiction has a 90% failure rate, which means 90% of people addicted to opiates, once they get off of them, 90% will relapse.
I don't know how many times I detoxed off of opiates, but I can't even count.
I'd lost hope, you know.
I just couldn't seem to really get it together.
I was pretty much at the end of my rope. Family gets sick of dealing with you. They don't know what else to do with you.
With buprenorphine, we get basically a 90% success rate. What buprenorphine does is it eliminates cravings without making you high. It's a mistake to think that this is another addictive treatment that people are getting high off of.
Suboxone doesn't do that to you. You don't have that euphoric feeling when you take it.
It didn't make me high. It didn't make me not feel like I was there.
You don't get all toxic on it. It's really a clean way to endure those sorts of fears and the things that always bother an addict about remaining in recovery.
Buprenorphine has a unique mode of action. It attaches to opiate receptors and in a sense fools the brain into thinking you've got opiates on board. So it eliminates opiate withdrawal.
The agony of the withdrawal is...
It's the most demoralizing and hopeless situation.
It's a nightmare.
However, it does not act like an opiate.
And that's where Suboxone helps, kicking all that stuff that comes along with the withdrawal.
Anyone who's an addict knows that just stopping opiates and staying clean is nearly impossible.
You're worried about the cravings and you're worried about going into relapse.
And cravings is why people relapse. It's like constantly, every day, every week, month, on their mind is the thought of using opiates again. We now have an ability to eliminate cravings without getting people high and to keep people away from opiates on an ongoing basis. This changes the playing field, and this is now treatment of choice in the opinion of many addiction doctors.
And my whole life has been in treatment, really. This is, in the last 10 years, I've been more free to be myself with Suboxone and buprenorphine than I ever have in my life.
I feel great. I feel normal.
It gave me back a life that I didn't know I was even going to have.
And I'm sober. And it has to do with, because somebody invented something that doesn't make you stupid and it helps you to, I don't know what it did to my brain, but it helped me to readjust and figure out how to live every day without taking drugs.
You don't have to relapse anymore. There's now a medicine that will eliminate your opiate cravings and allow you to live the drug-free life that you thought was impossible for yourself. If you think this treatment is for you, then find yourself a doctor who can prescribe you buprenorphine and get your life back on track.